Ay, ¿cuántos añitos tiene? ¿Cuántos años tiene? So hello again. So we have a nice case today, a very nice case today. I'm sorry I can make a live transmission of all the cases today, but I wanted to show you something that could be interesting for general US. We don't need to, just to show therapeutic, but also I believe diagnostic is very important, and it's very important because if we can do something uh, correct, you know, in terms of therapeutic with the patients and take the good decisions in terms of what is best, how we can do our situation. So this is a 57 years old female with history of liver cirrhosis and a mass, gastric mass, in the during the upper endoscopy that was performed in another hospital. So they find out this lesion, and they want to understand on US, if this lesion was a vascular lesion or not vascular lesion, because patients with this can perform also, gastric varices. But in this case, so we saw this mass here. You can see here. Pregúntale si estamos bien y si tengo retorno. So this mass here coming from the four layer, from the muscular layer, and you can see the characteristic of this lesion. This is a isogenic lesion from the four layer lesion, as you can see here in the B mode. So probably is a gist. So this is my first my first interpretation of this lesion. However, we need to see in mode. So first, this is a 3 centimeter lesion, almost. I believe it's almost 3 centimeter, maybe a little bit more. I will measure. So it's a 3 centimeter lesion by 20 millimeters. Interesting is to see different features that we need to understand how we differentiate malignant gist versus almost three characteristics that has been described many years ago on US. I believe French people. It was irregular shape. So this lesion on a shape you can see here, okay, have necrotic areas like this one. So very anechoic areas in the lesion, and is could have some calcifications. I believe this is small calcification. I don't believe that calcification is part of the malignant signs, but the study published that they showed that 92% for saying that this is a malignant lesion. However, many years after, so new technologies as contrast enhancement was used to evaluate the microvascularization of the lesion. That's why it was very important, and the results showed that that all GIST, in spite of this characteristic, not all GIST have very thickness vascularization. And nowadays, I believe replace for sure uh, replace the replace the contrast right now, which is good. I believe it's a nice technology, very easier to use. You see, you put the button and that's all. So now I need to see what I have this. Okay, let's see. So I want to see the vascularization inside the lesion, you see? So what I am looking now is the microvascularization. That's why we're talking. This patient have liver cirrhosis, so we need to take care about what we will do. So for now, at the moment, in this frame, in this 60 frames per second, what I see is a lot of microvascularization here. You can see very well a lot of microvascularization. You see the vessels here? Yes, but there are this is normal vessels from normal Gs, but this is thickness vessel. You see here? So this is not normal. So when you see this, there's a publication made in surgical endoscopy, I believe, a few years ago, with contrast enhancement, and they find out that when the stromal tumors like this one have big vessels like this one, look here, very, very nice. So irregular mass with this irregular vascularization and very thickness vessels, so the accuracy increased to more than 96%. But we are still like trying to be more objective, because from my side, yes, this is a possible malignant gist because of the three characteristics of the B mode, but also because of I believe we are now on the track with the AI DFI. Podemos ponerle la inteligencia. So together with MD Cons Group, we developed the AI DFI, or AI for microvascularization, as you wanted to call it. Estamos en vivo con la inteligencia. Oh, okay. So now I have my return. Sorry. Oh, hay que volver a abrir, creo que el sistema. Presta acá el mouse. Okay, so now, so you can see here, so we have a lot of vascularity. The maximum vascularization of the lesion, the maximum on the whole frames that we are looking here is 67 with a mean vascularity of 14. So it showed me that probably, in this kind of stromal tumors, you have more vascularization. So I can have an accuracy right now of 99% with this, characteristic of this, evaluation in general terms, because of the B modes characteristics and the microvascularization characteristics subjective, and now by objective wave we can measure 102 microvascularizations. Is a lot. So in normal stromal tumors we have less, and probably this will help us, to be more objective in the future. So from my perspective, this patient don't need fine needle biopsy. First, because I am sure that this is a stromal tumor. Second, because I am sure 99% that this is a malignant tumor, just because of technology. So I want to share with you this case today also. I am still working, I'm sorry. But well, I hope that you enjoyed this case, and I will see you soon during Euro US. Please, we have very nice cases. Dr. Iglesias Garcia, the team of Euro US is working very hard for this, so please join us there with live cases and very nice, resolution. We will discuss with experts from Europe and worldwide regarding what we can do right now and what we have as technology, and new technologies that are coming. So see you there, and thank you for looking us, please. you know, join us and try to share our live channel from the training center in Ecuador and IECED. Thank you. So see you soon. Bye.